All right, welcome to another deep dive. You're ready to learn some more. This time, we're tackling something that might not be on everyone's radar, but trust me, it's important stuff: ureteral obstruction.
Ureteral obstruction. Yeah, it sounds a little intimidating, huh?
It does, but basically, we're talking about blockages. Those tubes that carry urine from your kidneys to your bladder, if they get blocked, well, that's when things can get a bit tricky. And you know me, gotta stay ahead of the game, right? So we've got this video script that breaks it all down, and I gotta tell you, some of this stuff even surprised me.
When we think about how vital the kidneys are, they're constantly filtering waste from our blood.
Mm.
It really makes you appreciate the delicate balance in our bodies.
Absolutely. So the video jumps right in defining ureteral obstruction. It even uses the term hydronephrosis.
Hydronephrosis, it's basically a buildup of urine in the kidneys,
Yeah.
when the flow gets backed up because of the blockage. And that's where the real trouble starts. If it's not addressed, it can actually damage the kidneys.
Damage. Okay, so this is definitely not something to ignore. Now, the first thing that popped into my head when we started talking about blockages was kidney stones. Those are pretty commonly known, right? And the video does mention them as a frequent cause.
Kidney stones are definitely up there, and they can range in size, too. We're talking from teeny tiny, like a grain of sand, to unbelievably large, like a golf ball.
Wow, a golf ball. Okay, I'm suddenly feeling very thankful for my relatively small bladder. But here's the thing, the video lists all these other causes that I wouldn't have thought of.
It's not always so straightforward. You've got things like tumors, and they can actually be inside or outside the ureter.
Inside or outside. So it's not just a matter of something getting stuck in the tube, it can be pressure from something nearby, too.
Exactly. And then there's scarring, from past infections, maybe even surgeries or injuries. That scarring can narrow the ureter.
Making it harder for the urine to pass through. And then the video even mentioned congenital defects. So that means some people are born with these structural differences that can make them more susceptible, right?
Right. It could be that the ureters are narrower than normal.
Oh, wow. So even something like pregnancy can cause a temporary obstruction. That's pretty wild.
It is. That growing uterus can put pressure on those tubes, making them narrower and, you guessed it, obstructing the flow of urine. But in most cases, it resolves after delivery. Still, just goes to show you these blockages can happen even in the short term.
So with all these potential causes, how do we even know if something's wrong? The video really stressed the importance of early recognition, and some of the symptoms they described are pretty intense.
Well, severe pain is often the first thing people notice.
Pain, huh? Like what kind of pain are we talking about?
The video called it flank pain. It's that pain in your side or lower back where your kidneys are.
Ah, so not your average backache then.
Nope. This is much more intense, and the location is key. When that pain is in the flank area, it's a big red flag that something could be going on with your kidneys.
Got it. Flank pain. Definitely something to pay attention to. What about the urination changes? The video mentioned those too. Things like difficulty peeing, having to go more often, or even noticing you're producing less urine than usual.
All of those are classic signs. Think about it. A blockage in the ureter is like a bottleneck disrupting the flow. That's why you might have trouble going, feel like you constantly have to go, or see a decrease in your output.
Okay, makes sense. And then there's blood in the urine. Now that sounds pretty scary. The video described it as looking pink, red, or even brown.
It can definitely be alarming, and it's not always something you can see with the naked eye. Sometimes it's microscopic. But either way, blood in the urine usually means there's some irritation or damage in the urinary tract. It needs to be checked out.
Definitely a sign to see the doctor. Now, the video also listed infections as a potential symptom. Fever, chills, even cloudy or foul-smelling urine.
Right. And infections can be both a cause and a consequence of a blockage. If the urine can't flow properly, it creates this environment where bacteria can thrive, leading to infections. And those can be pretty nasty if they're not treated promptly.
So it's this vicious cycle. The blockage causes the infection, and the infection can worsen the blockage.
Exactly. And then there's one more symptom that might seem a little out of the blue: nausea and vomiting.
Wait, why would a blockage in the urinary system make someone feel sick to their stomach?
I know, right? It seems a little strange. But remember, the kidneys filter waste and toxins from the blood. When they can't function properly because of a blockage, those toxins build up. That can lead to a whole cascade of issues, including nausea and vomiting.
Oh, so it's like the body's way of saying, hey, something's seriously wrong here. We need to fix this.
Yeah.
Okay, so we've got all these warning signs to look out for, but how do doctors actually figure out if someone has ureteral obstruction? The video made it sound like a bit of a detective story, using different tests to put the pieces together.
It is a bit like that. They often start with imaging tests, like ultrasounds, CT scans, and MRIs.
But why so many different types of imaging? Wouldn't one be enough?
Well, each test gives a different view of the urinary tract. An ultrasound is quick and painless, kind of like a snapshot. It's a good first step to see if there's something that needs more investigating.
So it's like a quick check to rule things out.
Exactly. Then, if more detail is needed, a CT scan can really pinpoint the location and nature of the blockage. It's more precise.
And what about MRIs?
Those are great for visualizing soft tissues. So if a tumor is suspected, an MRI can provide really detailed images to help diagnose that.
Wow, it's amazing how they can get such a clear picture from these different imaging techniques. The video also mentioned urine and blood tests. What do those tell us?
Well, the urine test can detect things like blood, which we know can be a sign of a problem. It can also show signs of infection. And the blood tests are used to check how well your kidneys are functioning.
So they can see if those waste products are building up in the blood, which would indicate the kidneys aren't doing their job properly.
Right. By combining all the results, the imaging, urine, and blood work doctors can get a really good understanding of what's happening in the urinary system. That way, they can decide on the best treatment.
Okay, so speaking of treatment, the video lays out a whole flowchart of options. It starts with stents and something called nephrostomy tubes.
The main goal with those is to restore urine flow, either temporarily or more permanently. A ureteral stent is a small, flexible tube, think of it like a little scaffold, to keep the ureter open.
So it props the passage open, allowing the urine to drain. And a nephrostomy tube, is that similar?
It's a bit more involved. It's a tube that goes directly into the kidney through the skin, so the urine bypasses the blocked ureter completely. It's often used in more severe cases or as a temporary fix before other treatments.
Makes sense. And then sometimes surgery is necessary, right?
Yeah, if the blockage needs to be physically removed, think large kidney stones, tumors, structural issues.
So it's not always about just opening up the passageway. Sometimes the cause of the blockage needs to be taken out completely. And I know the video briefly mentioned medications, but didn't really go into detail.
Medications can be helpful for managing certain aspects, like fighting off infections with antibiotics. Or sometimes meds can even be used to shrink certain types of tumors that are causing the blockage.
Interesting. So it's not always about physically removing the blockage. Sometimes it's about managing the root cause. And then there are lifestyle adjustments, which the video linked to prevention tips.
Lifestyle is so important. We can't control everything, like congenital defects, but we can definitely take steps to lower our risk.
I was actually surprised by how much diet can influence the development of this condition. I'm really curious to hear more about those prevention tips. What can we do to keep those ureters clear and healthy?
Well, that's a great question and something we can definitely dive into.
So let's jump right into those prevention tips. The video really hammered home the importance of staying hydrated.
Hydration is key. Remember when we were talking about kidney stones? Well, when you're well hydrated, your urine is more diluted, less concentrated.
So it's like flushing out your system before those minerals have a chance to clump together.
Exactly. It's like giving those pesky minerals a swift exit. And, it's not just about how much you drink. What you eat also plays a big role.
Oh yeah, the video talked about that, like too much salt being a bad thing. Makes sense, throwing off that mineral balance in your urine, making it easier for stones to form.
Right. Excess salt is definitely something to watch out for. But here's something interesting. Calcium and potassium can actually help prevent stones.
Wait, calcium? Isn't that what a lot of kidney stones are made of?
It seems counterintuitive, right?
Yeah.
But the calcium you get from food that's protective, it binds to this stuff called oxalate in your intestines, stops it from being absorbed.
So it's like intercepting the oxalate before it can cause trouble in the kidneys.
Exactly. And potassium helps make your urine less acidic, which is important because those stones love to form in an acidic environment.
Okay, so we've got hydration, watching the salt, making sure we're getting enough calcium and potassium. Anything else?
Regular checkups are super important, especially for people with a history of urinary problems, or if it runs in the family.
So if you've had kidney stones before or your family has a history of urinary issues, getting those regular checkups can catch things early.
Early detection is key. It's
Right.
all about being proactive and taking care of yourself. It's amazing what we've learned about a condition that most people don't really think about.
I know, right? It really makes you realize that our bodies are these incredible interconnected systems. And even small things like what we eat and drink can have a big impact.
Absolutely. It's empowering to know that we have some control over our health destiny.
And you know what else I've been thinking about? It's not just about our own health. Learning about conditions like this, even if we don't personally experience them, it helps us understand and empathize with others who are going through it.
I totally agree. It's about that connection, that awareness. We're all in this together, facing different challenges, and having that understanding, that compassion, can make a world of difference.
That's such a powerful thought. It reminds us that everyone's fighting their own battles, and sometimes a little bit of kindness and understanding can go a long way.
Absolutely. Sometimes just listening can make all the difference. So, as we wrap up this deep dive into ureteral obstruction, I want to leave our listeners with one last thought.
What's that?
We've talked a lot about the physical aspects of this condition, but what about the emotional side? Imagine getting that diagnosis.
It must be really scary and overwhelming.
Exactly. The pain, the uncertainty, the impact on your life, it can all take a toll on your emotional well-being. And that's why seeking support is so important.
Don't try to go through it alone. Talk to your loved ones, find a support group, maybe even see a therapist.
Remember, you're not alone. And if you have a friend or family member going through this, be there for them. Listen, offer support, let them know you care.
Sometimes just knowing that someone cares and understands can make a world of difference. It's about creating that space of empathy and understanding. And on that note, I think it's time for us to wrap up this deep dive into ureteral obstruction.
We hope you found it informative and helpful.
As always, thanks for joining us on the deep dive. We'll catch you next time for another fascinating exploration of knowledge.
Until then, stay curious.
It's fascinating how we started with this specific condition, ureteral obstruction, and now we're talking about empathy and emotional well-being.
It really is. Health isn't just about our physical bodies, right? It's about our minds, our emotions. It's about the whole person.
Exactly. And I think that's a really important takeaway from this deep dive. We've learned about ureteral obstruction, the causes, the symptoms, the treatments, but it's also about understanding, compassion, taking care of ourselves and each other.
It is. We're all connected, We all face
Yeah.
challenges, whether they're physical, emotional, or mental. And by learning about different health conditions, even those we might not experience ourselves, we can cultivate empathy and understanding for others who are going through it.
So true. It's like everyone's fighting their own battles, and sometimes a little kindness can go a long way.
Absolutely. And thinking about ureteral obstruction, we've talked about prevention, but what about actually living with this condition? What's that like emotionally?
Right. We haven't really touched on how someone might feel if they're diagnosed with ureteral obstruction. It's got to be more than just the physical discomfort, right?
Imagine the anxiety, the uncertainty, the pain, the potential complications, how it affects your life. It all takes a toll.
It would be totally understandable to feel overwhelmed or scared.
And that's exactly why reaching out for support is so important. Don't go through this alone. Talk to your loved ones, connect with support groups, maybe see a therapist.
Don't be afraid to reach out. You're not alone. And if you have a friend or family member going through this, be there for them. Just listen, offer support, let them know you care.
Sometimes, just knowing someone cares, someone understands, can make all the difference. It's about creating a space of empathy and understanding.
That's a great way to put it. Well, on that note, I think it's time to wrap up our deep dive into ureteral obstruction. We've covered a lot of ground today, the science, the symptoms, even the emotional aspects.
We hope it's been informative and engaging for everyone.
Knowledge is power, right?
Yeah.
So hopefully everyone feels empowered to take charge of their health and well-being. And remember, if you're experiencing any of the symptoms we talked about, don't hesitate to reach out to your healthcare provider.
Early detection can make a huge difference.
As always, thanks for joining us on the Deep Dive.
Stay curious, and we'll see you next time for another fascinating exploration.